Hi, hello everybody. I welcome you all in another Ask Me Anything session, episode number 133. And today, the topic for the session will be urine infection in pregnancy. I would like to welcome Dr. Anurita Singh joining this session. So let's know something about doctor. Dr. Anurita Singh is a medical director of Cradles IVF and ART Center as well as of Divyajyoti Specialities Hospital in Meerut. She is a member of multiple organizations like FOGSI, FOGSI, IAGE, IFS, etc. She is an associate member of RCOG. She is also an executive member of UP ISAR. She has presented multiple papers in national and international forums. She is also awarded as a health icon by the Health Minister Shri Siddharth Nath Singh in 2017. She is also awarded with Nirbhaya Brave Heart Award by FOGSI. I would like to welcome you, Doctor, on a session and let's get started.
Thank you. Thank you, Pooja. Uh, Good evening, everyone. I'm Dr. Anurita Singh. I'm based in Meerut. I'm into private practice for practicing for last 23 years. So today the topic of discussion is urinary tract infection in pregnancy. As you all know, have you ever heard a man having UTI or urinary tract infection? No. But still, it is very pretty reasonable to say that UTI is way more common in women. In fact, what the statistics say that 1 in 5 women will have UTI at some point in their lives. To understand why is it so, one has to have the knowledge of the urinary tract anatomy of the female. It is a bit complicated, so let me simplify it. Back there, it is the anus, that is the opening of the large intestine through which the feces come out. Just in front of that is the vagina, which is the canal that leads to the uterus. And in front of that is the urethra, which is the outlet of the bladder, which stores urine. And the urine is made in the kidneys. So all these three openings are cramped up in a small space. So infection of the urethra is known as urethritis. Infection of the bladder is known as cystitis. And infection of the kidneys is known as pyelonephritis. We females, we have a short urethra as compared to men. That is why we are more prone to infection. The commonest bacteria is E. coli, which is the gut bacteria. Talking about UTI in pregnancy, pregnancy is a whole lot of a different ball game when it comes to treating a simple infection which can go up to a raging infection in a matter of days. And we really need to look into this deeply. But do you know this bacteria can stay in the bladder without causing any symptoms? Yes, it can. And that is known as asymptomatic bacteria. Asymptomatic bacteriuria. So urine testing is done as soon as the patient comes to you for the first checkup in pregnancy. If it is normal, it is repeated in the second trimester and then again in the third trimester. But if there is a presence of bacteria, then this has to be treated as it can progress up to a full-fledged infection. So what does pregnancy have a role in UTI? So pregnancy is a hormone-dependent situation and it causes physical damage as early as 6 weeks. Almost all women experience urethral dilatation, increased bladder volume, and decreased bladder tone. All these three conditions leads to stasis of the urine, leading to growth of the bacteria. To make the matters worse, the pregnant woman's urine gets concentrated. The GFR increases the movement of sugar more towards the urine than into the circulation, which is known as glycosuria, and both of which encourage bacterial growth and lower the body's ability to fight the bad bacteria trying to get in. Also, the gravid uterus and the fetus growing inside the uterus pushes on the bladder. So there is incomplete emptying of the bladder, which again leads to bacteria causing the urine to leak. There is a vesico-urethral reflux and the urine leaks. These changes with an already short urethra and along with that difficulty with the hygiene due to the over distended belly helps to make the UTI the most common infection during pregnancy. And the worrisome part of it, this UTI once treated, one should not be like glad that it is over. No, it can reoccur in pregnancy. Also, the women who have had a previous episode of UTI before conception are more prone to have it in the subsequent pregnancy. So, why are we so worried about UTI in pregnancy? As we all know, pregnancy is an immunocompromised state, putting the mother and the baby at a much higher risk because the infection can lead to anemia, high blood pressure, preeclampsia, preterm labor, leading to low birth weight babies. Also, the patient, if worsened, needs to get admitted and IV antibiotics needs to be started. Along with this, if the patient has got these few conditions, UTI tends to get worsened. Like if they have kidney disease, diabetes, sickle cell disease, polycystic ovaries, or any history of chronic discharge. So, what are the symptoms that the patient presents to us having UTI? As I already said, the patient can be asymptomatic even with the presence of bacteria, but we need to treat them so that they do not progress further. The patients can come with dysuria, urgency, increased frequency, can have fever with chills, can have flank pain, pelvic pain, and even hematuria, that is blood in urine. If this is not treated, 40% of these infections will be affecting the kidneys. So, what do we do to treat this UTI? If the patient comes to us with asymptomatic bacteriuria, we send the patient's urine culture, and in the meantime, we can empirically start antibiotics which are fetus friendly and wait for the culture report to come, and according to the sensitivity, then we can change the antibiotics. What is more important is to prescribe probiotics along with the antibiotics to the patient. While we are treating such patients, it is better to advise the patient how to prevent UTI, and if they have UTI, how to limit the UTI in such patients. So these points are very important. Telling them to stay well hydrated, about 7 to 8 glasses of liquid in a day. They should not hold the urine. They should urinate when the need arises. And cranberry juice has shown to have properties which can flush out the bacteria. Get enough of vitamin C. Practice good sexual hygiene. Nowadays, females are using Western toilet with a jet installed. And the water comes from backwards to forwards. This is a very important thing to wash from front to backwards, never from back to forwards. Use cotton nightwear and avoid using harsh soap and body wash in the genital area. Fortunately, this common infection is easily treated, so you remain healthy and a lot more comfortable in the completing your pregnancy. Thank you so much. I will take the questions.
Thanks a lot, doctor, for the insightful session. Yeah, we are having a lot of queries. So shall we start, doctor?
Yes, please.
Okay. So very first is from Pratima. She's 29 weeks pregnant and asking, is color Doppler scan necessary? And if yes, then in which week it should be done, as all her previous scans are normal?
Color Doppler normally with the level 2 scan that is usually done between 18 to 22 weeks of pregnancy. If that is normal, then it is not necessary. If the patient is having high blood pressure or some other finding, then we, and some clinical findings are there, then we need to go in for a color Doppler around 32 weeks. Otherwise, not required.
Thank you, doctor. Next is from Niharika. She is 33 weeks pregnant and having itching near vagina and passing urine a lot of times with some amount. And there is swelling in her stomach and legs. Doctor said that there is problem of protein in her urine and she is getting an BP of 130/90, 140/90. Her weight is 96 kg and having some breathing problem also. Would you please suggest her what she has to do to get out of these problems?
So protein in urine comes in two conditions. Either she is hypertensive in pregnancy or she is having urine infection. In both the cases, there can be urine protein in urine. So I would suggest to get her BP monitored, because again, as she said, she is having some swelling in the stomach and legs. That happens not in urine infection but with high BP. So her blood pressure needs to be monitored.
Thank you, doctor. Next is from Swapnali. Her baby's weight is not increasing, and she's asking how much and what all things she should eat. How much protein is required in 8 months of pregnancy?
Sorry, I didn't get the question. I'm not able to see the question here.
It is from app doctor.
Okay.
It is
Can
from
you repeat?
Yes,
Yeah.
it is from Swapnali. She is asking her baby's weight is not increasing. So, how much and what all things she should eat, and how much protein is required in 8 months of pregnancy?
I would like to know her age and 8 weeks without any prior history of any clinical complication in the pregnancy, or the pregnancy is going normal.
Okay, so Swapnali, if you are listening, then please mention what doctor has asked. And next is from Shiva, doctor. She's 26 weeks pregnant and have E. coli UTI and count is more than 1 lakh and presently using nitrofurantoin, yeah, nitrofurantoin
Nitrofurantoin, yes.
yeah, based on doctor's suggestion. Would you please suggest her some home remedies and let her know if nitrofurantoin can be continued in 7 months as well, as it is sensitive as per her urine culture?
Nitrofurantoin is very safe in pregnancy and can be continued from the initial starting of the treatment. Within 3 to 7 days, the doctor can prescribe her the treatment, and after about 3 days, she will respond to the treatment, and the urine infection will subside. But she can continue it for 7 days, and with that, she has to take about 7 to 8 glasses of liquid in a day. And I would tell her to avoid contact with the husband, abstinence till the meantime her infection settles down. Plenty of fluid and maintain her hygiene.
Thank you, doctor. Next is from Bhavya. She is 8 months pregnant and she has slightly urine infection and she has light pain in her uterus while moving legs.
Slight urine infection treated by antibiotics. I would like to know what her does she have constipation also, because constipation and urine infection combined can cause suprapubic pain.
Okay. So, Bhavya, if you are listening, then please mention the ask things. She is saying no. She doesn't have.
So normally in 8 months of pregnancy, lower abdomen stretching pain is there. She can take a simple paracetamol. If it is okay after taking paracetamol, then nothing to worry.
Thank you, doctor. And in Swapnali case, doctor, how much protein is required in 8 months pregnancy and baby weight is not increasing. So she's saying that she has normal pregnancy.
With no other symptoms, no medical complications in the mother.
No complications. Her age is
Yeah.
37.
37.
Yeah.
So she needs to take plenty of rest, lie in left lateral position so that there is optimal blood circulation reaching the baby. 37 years of age, she comes into the category of a high risk patient. She hasn't mentioned whether it is her first pregnancy. I would like to know the details.
Sure, doctor. Next is from Suchitra. She's 5 weeks pregnant and she doesn't have any vomiting sensation, doctor.
That
So
is
I
okay. Normally, 50% of the patients, they don't feel nausea or vomiting in pregnancy. That is okay.
thank you, doctor. Next is from Bhavani. She's 5 weeks pregnant and have intense vomiting sensation and unable to eat any food. Please suggest something.
The best thing is she should brush her teeth at bedtime, and she should keep something salty next to her bedside. And as soon as she gets up in the morning, she should eat that and then step down from her bed. And small, frequent meals she should take. And perhaps a doctor must have suggested some tablets to decrease the nausea. Small,
She's
frequent
also
meals.
she has pain in right side of abdomen. Is this related to urine infection?
Same patient?
Yes, doctor. Hello.
Hello? Can you hear me,
Hello.
Pooja?
Yes, doctor. Doctor, I have mentioned another question from
Yeah.
Bhavani. She's saying she has pain in her right side of abdomen. She's the same patient. And is this related to urine infection? This is her query.
Right side. It can be due to urine infection. She must have got her primary investigations done. We need to go through those investigations and scan also.
Thank you, doctor. Next is from Neha. Am I audible, doctor? Hello. Hello.
Yes, Pooja. Yes, can hear you.
Oh,
Yeah.
okay. Next is from Neha. She's 17 weeks, 4 days pregnant. She found very mild blood, less than a dot, a week ago. So she's taking susten since 8 weeks pregnancy after mild spotting in 17th week. Doctor suggested her to go for Proleutin depot once in 15 days. So after that mild spotting, she never experienced that. Still, how many months should she need to continue this injection? And she's having placenta at the posterior wall, reaching and covering the OS.
So the placenta is covering the os, probably because of that. A little stretching might have caused the spotting, and she has not had spotting for last so many weeks, so nothing to worry about. In about 80% of the patients, after the fifth month, the placenta moves upside, and there is nothing to worry. The rest 20% of the patients, the placenta remains down. The only problem that the patient can have is to land up in a cesarean section. So a repeat scan will clear the things out for the patient.
Thank you,
After
doctor.
the scan, she can stop the injections.
Sure, doctor. So, doctor, as you asked from Bhavya for her more details, 8 months pregnant and slightly urine infection and pain in uterus. She has mentioned some details.
Yes.
She has thyroid 6.30 now. She's using 37.5 mg tablet. She and her baby increasing more weight. For 31 weeks, baby weight is 1.9 kg.
That's okay. That's okay. Baby weight is okay. And thyroid tablet has to be continued.
Thank you, doctor. Next is from Darshika. Sometimes she has severe headache. So can she take half Saridon? Besides, is headache normal in pregnancy? She is 17 weeks pregnant.
Normally, the headache is due to three conditions. It's a hypoglycemic headache. For that, she has to eat a small frequent meal she has to have and get her blood pressure checked. And thirdly, her eyesight. For the headache, she can have a simple paracetamol if that helps.
Thank you, doctor. Next is from Varsha. Does itching in vaginal area is UTI?
It can be because of fungal infection also. And the way they remove the hair down below, which should be proper, trimming is better instead of removing the hair. And she should get herself checked for fungal infection.
Sure, doctor. Next is from Priyanka. She is 28 weeks pregnant. Her last ultrasound was at level 2 at 19 weeks. When should the next ultrasound be done? All reports are normal.
If all reports are normal, the third scan normally happens if there is some difficulty during term. At term, it should be repeated if there is some difficulty. Otherwise, a level 2 scan, which is normal and the pregnancy is going on normally, there is no need to get a third scan done.
Thank you, doctor. Next is from Jigyasa. She is 27 weeks pregnant and have been through 4 UTI during this period. Recently, she has consulted urologist and was advised to go for abdomen and pelvis scan. Please advise the precautions.
A normal ultrasound scan has been recommended. UTI, as I've already said in my talk, UTI can reoccur in pregnancy, which is a very common thing. We need to follow these precautions so that it doesn't happen or the UTI gets limited. Like I said, plenty of water, maintaining a proper hygiene, and having probiotics. A scan can rule out if the infection is progressing, having pyelonephritis, if there is a hydroureter or kidneys are getting infected. That's it to rule out. We can get a scan done.
Thank
And
you,
also,
doctor.
she should get her sugar levels tested. If she is having frequent UTI, whether her family has a positive history of diabetes, what is her diabetic status, we need to know.
Thank you, doctor. Next is from Chesta. Today, at her anomaly scan, fundo posterior wall grade 1 was seen. So, what all should she take care of? Can she continue with mild exercise? She is
Can you
20
can,
weeks pregnant.
can you repeat the question?
Yes, doctor.
Yeah.
It is from Chesta. Today, at her anomaly scan, fundo posterior wall grade 1 was seen. What all should she take care of? This is her query. And can she continue with mild exercise? She's 20
Fundo,
weeks pregnant.
fundo posterior fibroid, what is seen? This
Yes.
is
Fundo posterior wall grade 1.
fundo posterior
This,
placenta grade 1.
I guess she wants to say
Yeah,
this
that
only,
is
doctor.
incomplete.
Yeah.
Fundo posterior placenta, that is okay. That is normal. Grade 1 at this time is normal. Light exercise, she can go in for walking, which is best.
Thank you, doctor. Next is from Radha. She is 8 weeks pregnant and she has ITP and her latest count of platelets is 1.4 lakhs. So she is feeling indigestion from last week and unable to eat anything. Even tablets like folic acid and progesterone suggested by doctor.
Progesterone, she can take it vaginally. Folic acid is one tablet. She can have it any time of the day. She can have it with a little sip of water and uh, for the vomiting, her doctor must have prescribed something. She can take that. Small frequent meals she can have. Fruits and juices should be avoided at this time.
Thank you, doctor. Next is from Sarika. She's 7 weeks pregnant and feel wet in vagina area. So, is there anything serious?
No, normal vaginal discharge, which is a very common thing, nothing to worry about. If it is white, frothy discharge like curdled milk, then it is a fungal infection. Otherwise, it's a normal vaginal discharge. It is very common to feel wet in the vaginal area, nothing to worry about.
Thank you, doctor. Next is from Sai Krishna. What if creatinine is very low in urine?
That depends on the lab which has done the test. Very low creatinine is of no value. High creatinine is okay. That should be worried about. Low creatinine is nothing to worry about.
Thank you, doctor. Next is from Pooja. She is 26 weeks pregnant with twins. Since 2 days, baby movement was very slow. Please suggest something.
What is the gestation? How many weeks of pregnancy?
26 weeks, doctor.
Twin pregnancy of how many weeks?
Doctor, it is 26 weeks.
26 weeks, it is too early to say about, to comment on the movement. After about 30 weeks, we should be really bothered about. But her level 2 scan, guess, I think that was normal. And in case she is not feeling any movement, she should lie down in left lateral position and she might feel the movement. Sometimes because of the over distension of the uterus, because of the twin pregnancy, she might not feel the movements.
Thank you, doctor. Next is from Neha. She got 20-30 pus cells count in her urine test. Doctor didn't give her any medication for the same. What precautions should she be taking? This is the first time she has got this infection.
If she is not having any symptoms, she can get a urine culture done, and according to that, whatever sensitivity comes, antibiotic can be started, because 20 to 30 per cells is quite a lot. The normal is till 5.
Sure, doctor. Next is from Ritu. She is 35 weeks pregnant. Her baby stretches too much himself in her stomach. Why does it happen?
That's a normal growth pattern of the fetus. The fetus keeps on moving inside the uterus, and you can feel sometimes the uterus gets very tense without the pain. If the uterus is getting tense very hard, it's a normal thing. That is the time when the blood gushes into the uterus. And the baby movement, you can feel the stretching of the baby. With that, you can feel a little bit of pain also, which is normal during fetal movement.
Thank you, doctor. Next is from Nikita. It is her 10th week of pregnancy and she has pain in her right part of the stomach. It
can be due to indigestion also, and her blood pressure right above abdomen, if sometimes the liver capsule stretches, so that causes little bit of pain. So I need to know the history whether her blood pressure is normal or not. Sometimes we do feel the pain in the right upper abdomen. That is because of the stretching of the liver capsule.
Thank you, doctor. Next is from Femina. उन्हें वजाइना में थोड़ा सा स्वेलन है एंड पेन होता है एंड उनका 31 वीक्स का प्रेगनेंसी चल रहा है एंड एवरीथिंग इज नॉर्मल.
If she is having unilateral swelling, she should get herself checked for any Bartholin cyst infection, because unilateral pain in the vagina, swelling in the vagina, can be due to some infection of the Bartholin cyst. So at this time, an antibiotic course can subside the swelling.
Thank you, doctor. Next is from Shiva Ramya. She has borderline gestational diabetes and E. coli infection. So, are these both interrelated? And with UTI, can she do prenatal yoga in 26 weeks?
Yoga, yes, she can do, but with her she is pre-diabetic and she is having UTI, so her UTI needs to be treated with antibiotic. Otherwise, this can progress to a full-fledged infection. So the UTI needs to be treated.
Thank you, doctor. Next is from Hima Varsha. Does itching in vaginal area means UTI? She doesn't have any burning sensation while passing urine. All is having is itching in vaginal area.
Simple vaginal itching can be because of the fungal infection. If she's not having any discharge, then it is okay. Simple washing with simple plain water will do. If not, she can go in for a urine test, or she should get herself tested for fungal infection.
Thank you, doctor. Next is from Isha. She is asking, can electric trimmer be used to trim public hair?
Yes, she can.
Next is from Bharti. Probiotics said by you. Is it similar to Yakult available in the market?
Yes, it's very much similar, but you can have दही घर पे होती है, दही खूब खाएं. Yakult is the same. You can have it.
And she has one more question, doctor. She is in 20 weeks of pregnancy and her gynec advised her to mop the floor from 5th month onwards. Her legs and feet are a bit swollen and she is a bit skeptical whether to start this.
There is no medical logic to tell the patient to mop the floor. I mean, if she wants to work, she can. She's not able to squat on the floor. She can do standing mop. She can do, but there is no medical logic behind to go in for mopping the floor. If she cannot do it, she should not do it.
Thank you, doctor. Next is from Gautami. She is in the 5th month of pregnancy and asking why right middle side getting pain.
Right middle side. Does she have any other symptoms? Urine infection or something?
She has not
She hasn't
mentioned
mentioned.
it.
Yes.
If you are listening, then please mention.
If this is a constant pain, this needs to be investigated. If it's a one-off thing, she can take a simple paracetamol. If it goes with that, then it is nothing to worry about.
Thank you, doctor. Next is from Shilpi. She is 22 weeks pregnant but can't feel kicks. Is it normal?
Whether it is a first pregnancy, because in the first pregnancy, sometimes the fetal movement can be felt a little late. So this is normal. If she cannot feed it right now, another 1 month, 3 weeks to 1 month, she will be able to feel the kicks.
Thank you, doctor. Next is from Radha. 8 weeks pregnancy and having slight abdominal pains once in a while.
That can be because of urine infection, or sometimes the patient can have constipation that can lead to pain. Otherwise, she must have been investigated. If everything is normal, then nothing to worry.
Thank you, doctor. Next is of Gunshri. She is 22 weeks pregnant and is thyroid patient taking 50 mg tablet. She doesn't see, is not putting on much weight. So is it related to her thyroid?
It can be related to thyroid, but it's nothing to worry. The baby takes the weight from the mother. Unless and until the mother is having some great medical problems, then we have to worry about the mother weight. But the baby weight, it turns out to be comes out to be normal. So not to worry.
थैंक यू डॉक्टर नेक्स्ट इज फ्रॉम अंजलि मैम मुझे कल से मोशन होने की फीलिंग हो रही है बट जाने पे ही नहीं रहा है और पेट टाइट होके हल्का पेन हो रहा है फिर ठीक हो जा रहा है और भूख नहीं लग रहा है ये लेबर का साइन है क्या मैम मेरा 9th मंथ 3 सितंबर को पूरा हो जाएगा तो ऐसे की क्यों हो रहा है प्लीज हेल्प
नहीं, अगर इनको कॉन्स्टिपेशन हो रहा है और मोशन नहीं हो रहा है, she can use glycerin suppository or Dulcolax suppository so that she passes a motion, and once the motion she passes, she'll be able to भूख भी इनकी खुल जाएगी एंड दैट इज ओके. थर्ड सितंबर को उनका 9th पूरा होगा. सो ये लेबर पेन के साइन नहीं होते, कॉन्स्टिपेशन की वजह से हो रहा है इनको.
Thank you, doctor. Next is from Ritu. Should she leave to take tablets of iron and calcium in 35th week? She is having pain in back and in pelvis area. So please give your.
Iron and calcium has to be taken for continuous 9 months, and even in the after once the baby is born, the iron and calcium need to be continued. So it is not related to the back pain. You can continue with the iron and calcium.
Thank you, doctor. Next is from Geeta. Her 5th week is going on and her HCG is 776. Is it normal? And she is pregnant or what?
It depends where she got her test done. The lab's normal range according to the weeks is how much? She can check in the report. They have got a normal range for that test. If it is within that normal range, that's okay. If she is having any other complications along with it, then the doctor can prescribe HCG injections and progesterone along with it.
Thank you, doctor. Next is from January ideas. Okay. First pregnancy, IUI, twins, and she's 35 years old, 35 weeks of pregnancy. Her AFI is 5.5 in each sac. Doctor says let's not wait till 37 to 39 weeks and do a cesarean by end of 36 weeks. Is it okay? Should she not wait? And she keeps getting itching quickly in her vaginal area. She has even used Surface, but it gets cured and starts again.
Firstly, she should go with the whatever your doctor is saying. At 36 weeks, she should go in for a cesarean section because the amniotic fluid is very less. So that will harm the babies. So she should go ahead with the cesarean section. As far as vaginal infection is concerned, Surfraz, it should not be used. I think it contains some corticosteroid. That is why it gets cured and starts again. A simple candid ointment can be used and washing with plain water.
Thank you, doctor. Next is from Jigyasa. She has ice cold sensation on her left thigh. Is it due to urine infection?
Whether she is pregnant or not, or a non-pregnant state?
Doctor, let's take it as pregnancy case only.
Sometimes because of the some nerves can cause this ice cold sensation. It is not related to urine infection.
Thank you, doctor. Next is from Ruchi. She is asking reason of back pain. Please tell her the reasons.
In pregnancy, the back pain is very normal because there is stretching of the ligaments which are attached to the spinal cord. So anytime the back pain happens, the patient should lie down, relax herself, and then she can get up and do the work again. Back pain is very normal in pregnancy due to stretching.
Thank you, doctor. Next is from Arupi. 12 weeks of pregnancy, age is 30, suffering from piles and constipation. Please suggest her will be able to take treatment or not.
In pregnancy, because of the progesterone, piles do happen, but you are suffering from constipation, so your constipation has to be relieved. You should eat plenty of salads, have plenty of water, relieve your constipation, and your piles will be cured.
Thank you, doctor. Pallav is asking, is removing public hair increase the chances of UTI?
It depends with what you are removing. If you are not hygienic enough to use a razor or a blade, every time you should use a new one. Or I would suggest simple trimming of the hair is better.
Thank you, doctor. Next is from Sai Krishna. Does white discharge create any difficulty in getting conceived?
White discharge is a normal vaginal secretion. If it is curdy white and itching is there, then it is vaginal infection. Otherwise, a normal discharge, it increases before your periods, after your periods, and in between the periods when the woman is ovulating, this vaginal discharge increases. Without any itching, if you have vaginal discharge, that is normal and nothing to worry about.
Thank you, doctor. Next is from Rashmi. She's 22 weeks pregnant, having incompetent cervix and done cerclage. Right now, taking progesterone injections. Is there any chances of UTI?
The procedure as such does not lead to UTI if you are not maintaining the hygiene, because in pregnancy, and she probably is on bed rest, the hygiene has to be maintained, plenty of water, and she will not have UTI. Nothing to do with the procedure.
Thank you, doctor. Next is from Bhargavi. 6.3 weeks of pregnancy and the baby heartbeat is 111. Is it risky?
Sorry, I didn't get the question. I cannot see the question also.
Doctor, it's on the screen. It's from Bhargavi. 6.3 weeks of pregnancy and baby heartbeat is 111. Is it risky?
This needs to be followed up. It can come into bradycardia. It needs to be followed up. In a subsequent scan, we need to see.
Thank you, doctor. Next is from Archana. Having high pus cells during first trimester, took medication and reduced. Again in 7th month, got light UTI, took medicines. Why is it reoccurring again? Will it affect her baby? Now she is in 37 weeks of pregnancy.
No, rest assured it will not affect the baby. You're already in your 37th week, but as I had said in my talk, UTI can happen again and again. Even after getting treated it once, it will happen again. It can happen again. So that's okay. You can get it treated again and it will not affect the baby.
Thank you, doctor. Next is from Malvika. She is 22 weeks pregnant and उन्हें स्टार्टिंग ऑफ प्रेगनेंसी से यूरिन इन्फेक्शन है. डॉक्टर ने सिर्फ पानी पियो. Okay, खाने पानी पियो, nothing else. Does this infection affect her baby? What are do's and don'ts?
Urine infection per se does not have any harmful effect on the baby, but if it is if it is a full-fledged infection, she would have done a culture sensitivity test for the patient, and based on that, antibiotics can be started, which will control the UTI. Plenty of water again, maintaining of hygiene. That's it.
Thank you, doctor. Next is from Renu. She is 24 weeks pregnant and going through itching in vaginal area and inside also. It may be fungal infection. Is it serious? Please suggest.
In pregnancy, fungal infection is very common and it gets treated. It's totally treatable and you can take medication, local medication also, some vaginal tablets to be inserted, and it is not serious, so don't worry.
Thank you, doctor. Next is from Rashmi. She's asking, can she take cranberry juice from and me brand which is available for UTI?
Yes, she can have cranberry juice, but unsweetened. No sugar, no added sugar should be there in the cranberry juice. Any brand which is available, but make sure it is unsweetened.
Thank you, doctor. Next is from Bhavani. Her thyroid levels are 5.3, taking 75 mg for 5 days in a week and 100 mg for other 2 days. Is it fine?
Yeah, according to it, it is fine, but your thyroid levels, they need to be tested in every trimester. Every 3 months, your thyroid level needs to be tested and the dose should be adjusted.
Thank you, doctor. Next is from Priyanka. She is 25 weeks. She is in 25 weeks of pregnancy. Have pregnancy phobia from starting as time is coming near. So she is worried how to get out of this. Please suggest.
You should talk to your friends who have had babies, and pregnancy is nothing to be worried about. It's a God's gift. So just relax, talk to your friends, do some meditation, and relax. That's the most wonderful gift a lady can have.
Thank you, doctor, and all the best, Priyanka. Next is from Hina. She's in her 7 weeks of pregnancy now, and she had a severe UTI, had blood in the urine, and severe pain before she knew she was pregnant. Is this okay?
Yeah, that is okay. And UTI, I hope the UTI is treated in the initial stage because she had hematuria. So that means UTI must have been from the first stage onto the second stage. If it is treated, then is nothing to be worried about. And your subsequent scan will show that pregnancy is okay.
Thank you, doctor. Next is from Nana. She is in her 28 weeks of pregnancy and experiencing white, thick discharge from past few days. Is it normal?
This indicates a fungal infection. She should wash with simple plain water and consult your doctor. She will prescribe some medication.
Thank you, doctor. Next is from Gunshri. Hello, doctor. The question is on the screen.
Can you hear me, Pooja?
Am I audible,
Hello?
doctor?
Pooja, can you hear me?
Hello. Am I audible,
Hello?
doctor? Yes, I can
Yes.
hear you, doctor.
Yeah.
Question is on the screen, doctor.
Okay. This is Drushal. Uh, hello? Hello?
Hello, doctor. It's from Gunshri. She's getting lower back pain and knee joint pain, and she's in 22 weeks of pregnancy. Also, at times, she's feeling burning sensation in palm and legs. Can any home remedies helps in getting over this pain?
Is it this first pregnancy, or because knee joint sometimes lack of calcium causes knee joint pains? So get a calcium level tested. She must be taking calcium, and vitamin D can be added.
Okay. She asked a question earlier that she is also a thyroid patient and taking 50 mg tablet.
That's okay.
So, okay.
That is okay.
Next is from Hina. She had antibiotics and it became all right. She even did a urine test recently and it all came back normal. So, should she be worried if it can be repeated?
Normally, urine test is repeated every 3 months in every trimester. So last one came normal. When she is due for her next test, she should see the test next test when it is done. If it is normal, then nothing to worry.
Thank you, doctor. Next is from Namita. She's 7 weeks pregnant. Doctor suggested levothyroxine. Her TSH is 2.5. It should be within 2 for first trimester. Is it necessary to take or can she control naturally?
No, it is. It is necessary, she should be on tablets. Naturally, you cannot control the thyroid. And when you're pregnant, she should do what the doctor has advised.
Thank you, doctor. Next is from Manisha. She is 10 weeks pregnant and her baby weight heartbeat is 144. Is it normal or what?
That is normal. Manisha, that is normal, nothing to worry.
Thank you, doctor. Next is from Brushali. She is 25 weeks pregnant and having pain in right upper abdomen near the rib cage and it's little tight. What does it mean? And is there anything to worry about?
Sometimes stretching of the liver capsule causes this pain. I would like her to get her BP monitored. If that is okay, then nothing to worry.
Thank you, doctor. Next is from Drushal. She's at 36 weeks, 2 rounds of antibiotics, but still getting pus cells and bacteria in urine test. What precautions need to be taken?
Whether she is taking antibiotic according to her culture sensitivity test, and doctor can change the antibiotic and see if it is helping her or not. Precaution only, plenty of water, maintaining a good hygiene. That's it. Avoiding any harsh soap or body wash in the genital area.
Thank you, doctor. Next is from S. Makhija. Uh, T3 is 1.93, T4 is 16.40, TSH is 0.01. Is it okay, doctor? As she is 24 weeks pregnant.
24 weeks pregnant, it's okay. Not to worry. T3, T4, that's okay. Nothing to worry.
Thank you, doctor. Next is from Renu. Her doctor suggested luliconazole cream 1% for itching. Is it safe to use inside the vaginal area?
You should use only outside. I mean, not inserting inside. Inside, you should use only a vaginal pessary if the doctor has suggested. This cream should not be inserted inside.
Thank you, doctor. Next is from Achu. 7 weeks of pregnancy, having brown discharge. Will it affect her baby?
Brown discharge, she should get her scan done. Normally, this brown discharge happens when there is a missed abortion. So, at 7 weeks of pregnant, I would advise her to get her scan repeated.
Thank you, doctor. In the next question, doctor, as Renu asked that this cream she is using, but she is not getting any cure. Like because she is using this cream from 1 week, but it's not curing. Would you like to recommend something else?
She can ask her doctor to advise for some vaginal pessaries, antifungal pessaries, which are very helpful.
Sure, doctor. Next is from doctor. Next is from Preeti. So she is
Yes.
16 weeks, 6 days pregnant, and she was 55 kgs when she conceived, and now she is at 62.5 kgs. She has gained 7.5 kgs in 16 weeks only. So is it too high at this stage or is it normal?
Now that depends if she's having high blood pressure. So that depends on the overall picture of the patient. Sometimes the patient tend to increase more of weight. If the rate of increase in the weight is too much, then it all goes towards the mother's side. The baby, the slow steady rise of weight, which is helpful for the fetus. If it is high rise in the weight, then one has to be concerned and get her blood pressure checked.
Thank you, doctor. I guess we are done with all the questions. Uh, I'm just checking, like, do we have? No. So we are all done with the questions. Thanks a lot, doctor, for this
Thank
wonderful
you so much.
session. You
Thank
just,
you,
I
Pooja.
guess, replied to all the queries in so detail, and almost all the queries are solved today.
Thank you so much. Thank you. Thank you.
So, any last message, doctor, you have for to be moms?
Just need to relax, and I think iMumz has this meditation schedule which helps a lot into nowadays with this coronavirus and so much of tension and stressful lifestyle. One should with all the medications and what the doctor has prescribed, one should go in for simple meditation techniques which helps a lot. So I would advise all the moms to be relaxed and enjoy this period, and all the best for the future.
Thanks a lot, doctor. Thank you so much
Thank
for
you.
this session,
Thank you,
and
Pooja.
thank you everybody else for joining the session. We'll see you
Thank
tomorrow
you.
again at 6 o'clock. Till then, take care. Bye bye. Bye, doctor.
Thank you. Bye bye, Pooja. Bye bye.